Tobacco smoke enemas? Glass in the eyes? Medicine has made leaps and bounds over the last 2 centuries, but it took a lot of work to get here. Throughout history, there are a ton of medical treatments that range from counterproductive to outright dangerous. Hacking up a lung? Nowadays, you might take something like cough syrup, but in the 1700s, there were some natural treatments you could try. The Pharmacopoeia Officinalis and Extemporanea, a 1722 volume of then-current medical knowledge by John Quincy, describes album graecum and stercus equi, both of which were used to treat throat and respiratory illnesses. So what are those mysterious Latin words? This is where it gets gross. Album graecum was dog poo, but not just any dog poo. It was poo that had dried until it was white, was crumbled up and mixed with honey, and then taken orally. Yes, actual doggy business you would eat. It was primarily for treating inflammation of the throat, and amusingly enough, Quincy also remarks it doesn't really work that well. So basically, it turns out 1700s doctors were making people eat dog feces for no particular reason. Then there's stercus equi. Similar to album graecum, this was dried, hardened horse dung. It too was mixed with something else. Quincy recommends pennyroyal water or white wine. Fancy. Unlike the doggy do though, the horse apples apparently actually helped, according to Quincy. It could reportedly treat asthma and other breathing difficulties quite handily. It's probably best to stick with your inhaler though. While people now look at them skeptically, cure-alls were a big deal throughout history. Historical doctors would find a random substance and get someone to take it. That included any animal byproducts they could get their hands on. A good example was ambergris, a rare waxy material that is essentially whale vomit. In Pantalogia, a 19th century encyclopedia, ambergris is mentioned as a medicine to treat stomach problems, spasms, and could work as a cordial, which is an old-fashioned term for a cure-all. The downside was ambergris smells awful, so it had to be heavily masked in a drink or food to administer it without making the patient nauseous. It's actually still used today, but in cosmetics, not medicine.
The excretion is so valuable it's referred to as a floating gold.
Another fun one was snail slime, which was believed to treat tuberculosis and straighten deformed limbs, among a wide variety of other conditions. It wasn't always just the slime. Sometimes doctors would remove a snail from its shell and mash it up or have the patient swallow the animal whole. In the olden days, what doctors knew about the digestive system was basically a series of wild guesses. When it came to stomach issues, it was really hard to tell what was going on and even harder to treat it. But our ancestors had a magic pill that could help. It was a lump of antimony, a somewhat rare metal and number 51 on the periodic table that needed to be swallowed by the patient. It actually worked to a degree, but only because antimony is very toxic to humans. It basically cleared out the digestive tract by poisoning everything as it went down. Even that wasn't the gross part, though. The gross part is what happens afterward. Naturally, the antimony was eventually expelled by natural means. It was then cleaned for reuse. Yes, seriously. As previously mentioned, antimony is somewhat rare and was pretty expensive at the time. As noted in the Medical Critic and Guide, a single antimony pill could last a lifetime. Not only that, but they were frequently passed down as heirlooms, meaning you were swallowing something that had been in Grandpa's rectum just a few years beforehand. Yum. One thing historical doctors loved is what's now called corpse medicine. No, it's not cough syrup for your Halloween skeletons. It is in fact medicine made from corpses. And medicine may be a stretch, because like many old-fashioned treatments, the efficacy of these was mixed, at best. One particularly popular one across several centuries was called, among many other names, Armsunderfett, which is German for poor sinner's fat. That's not a clever euphemism. It was literally human fat harvested from dead criminals, according to defiled trades and social outcasts. In fact, human remains were very valuable, so executioners in the Middle Ages would often gather fat, organs, hair, and various other parts of the body to sell to anyone who wanted them. It was completely normal at the time. Poor sinner's fat could be melted down into a salve, which was supposed to help with joint and bone problems. Then there was a cure-all called mummia. While it initially referred to the kind of bitumen used in mummification, over time the name got confused to the point where people assumed that mummia was made of the mummies themselves. And soon the bitumen was replaced by containers of powdered mummies, mostly from Egypt. Eventually this caused a shortage of mummies, so people mummified fresh corpses and then ground those up instead, according to Egyptology, the missing millennium. Nowadays, hemorrhoids are usually treated with creams, but in centuries past, the treatment was far more terrifying. Historical surgeons would heat up iron rods until they were red hot, then apply them directly to a patient's body in order to cauterize the hemorrhoids. If that sounds more painful than just dealing with a hemorrhoid, that's because it was. Surgical removal of hemorrhoids is a thing today in some rare cases, but it's done with actual surgical instruments. Also keep in mind that anesthesia wasn't a thing yet back then. Hippocrates, the guy the Hippocratic Oath is named after, even wrote about this revolting practice. This wasn't the only disturbing way to treat hemorrhoids, though. There was also a tool known as an ecraser, which was a handle connected to a loop of chain. This loop was wrapped around a hemorrhoid. Then the chain was tightened link by link until the circulation was cut off to the protuberance your doctor wanted to remove. It would then eventually be tightened even more until it was pinched off. Again, no anesthesia, though at least the device kept external bleeding to a minimum. Today, there are numerous teeth whitening products available, from special toothpaste to strips or trays. Teeth whitening will be a $4.7 billion industry by 2024, according to Dentistry Today. In ancient Rome, teeth whitening was also popular, but they didn't have the plethora of options modern people do, so they used something gross instead, their own pee, according to Smithsonian Magazine. This method was so popular that Roman poet Catullus wrote a verse about it, called On Ignatius of the White Teeth. It talks about a man named Ignatius who smiles all the time, even at funerals, because his teeth are so white, but they only got that way because he used pee to whiten them. It's basically an ancient diss track, as Catullus is making fun of Ignatius, but it does show that this was a well-known practice. The way it worked was one would pee into a container of some kind, then wait until the urine broke down. Then it was rubbed on the teeth and gums. The thing is, it actually kind of worked. Aged urine is basically pure ammonia, which does indeed whiten teeth. So while it's very disgusting, it did do what it was intended for. In the 17th and 18th centuries, tobacco had just begun being imported to England from America, and this led to one of the strangest medical treatments in history. Initially, it was limited to drowning or hypothermia victims. Medical practitioners wanted to warm patients quickly and promote respiration, but instead of using blankets or heat source, they decided the best solution was to literally blow smoke up people's butts. When this appeared moderately successful, likely due to a patient having time to warm up naturally and not the smoke, tobacco smoke enemas quickly became all the rage, and they began to be used for treatment of all kinds of maladies like colds or even typhoid, according to the British Columbia Medical Journal. The enemas were administered by doctors hooking a tube up to you-know-where and blowing warm tobacco smoke into the other end of said tube. It wasn't exactly a complicated system, and the doctor doing it usually didn't worry about being sanitary, since humans hadn't discovered germs or bacteria. It was just a tube and regular old tobacco smoke. Later systems did include a bellows instead. The treatments could reportedly take quite a while, and were eventually found to be completely ineffective, so the fad died down by the early 19th century. Dental hygiene was decidedly not a thing for thousands of years of human existence, so a lot of folks didn't pay too much mind to their teeth until they started causing them pain.
You okay, Ron?
Just a little tooth pain.
Then they'd get serious and have the tooth extracted, though as a stopgap, they might try a variety of pain relief methods. Some were fairly ordinary, like heat or cold applied to the jaw near the tooth, and some cultures even developed painkillers like opioids to temporarily stop the pain. But ancient Egypt had to go and make things weird. They developed a sort of toothpaste that one could use to treat tooth pain, but it wasn't made out of the stuff people use today. Instead, their toothpaste was created from a variety of ingredients, with one of the more consistent additions being mice, meaning that a live mouse was smashed up into a paste, which was then placed on the tooth, causing the pain. If you thought fluoride treatments at the dentist were bad, this is far more disgusting. Sometimes the mouse wasn't even mashed up, but instead cut in half, and the still warm body of the mouse was placed directly on the affected tooth, according to the beginnings of dental caries and its treatments. Its efficacy is unknown, but considering dead mice have no known pain-relieving properties, it's a pretty safe guess that the mouse paste probably did nothing at all. Historically, men have had a serious interest in machismo and masculinity, and throughout the ages, medical professionals have cooked up numerous remedies to improve male fertility and virility. Before little blue pills were a thing, there were all kinds of specious treatments to turn back the clock on manhood, but none were as distasteful as those proffered by a 20th century huckster named John Brinkley. Brinkley posed as a trained doctor, but was nothing of the sort. He was a quack who managed to dupe thousands of people into throwing their money away on a ghastly treatment that did nothing. Brinkley's procedure involved slicing open the scrotum and implanting 2 goat testicles alongside the man's existing equipment. The idea was that these extra gonads would augment the man's reproductive system in various ways. Because goats were considered to be a symbol of male potency, this was just assumed to work. He didn't even connect them to anything, just placed them inside the scrotum and sewed it back up. Naturally, they did nothing at best and caused infections and rejection symptoms at worst. Turns out you can't just stick any old thing into a human body and expect our immune systems to not freak out. Numerous people who underwent the xenotransplantation ended up having a lot of problems. Brinkley was eventually exposed as a con man, and his empire of goat testicles quickly collapsed. While eye drops today are somewhat unpleasant, between putting chemicals in your eyes and remembering the annoying Ben Stein Visine commercials, they're nothing compared to the eye treatments that doctors in ancient Egypt whipped up. Ancient Egyptians, as you might recall from history class, were quite fond of animals, and so their medical treatments typically revolved around animals and their byproducts. One particularly gross treatment for an eye infection was drops of bat blood, which would supposedly cancel out the infection. Got pink eye? Get ready for red eye. It was believed that the bat's advanced night vision would somehow transfer onto the patient, though obviously that's not how medicine works. Even that was pretty tame when compared with how they treated cataracts, though. No animal bodily fluids were involved. Instead, pieces of glass were heated up, then dropped directly into the eye, according to strange medicine. It was allegedly kind of successful, in that the heat of the glass and its natural roughness may have burned or scratched away the cataract, but it couldn't have been particularly pleasant, and it did run the risk of blinding the patient completely. It's also not clear where this idea originated from, but it's easy to assume that it was invented by someone who was really desperate to remove some pesky cataracts and didn't care about the consequences.